This is The Naked Patient, Beyond the Operating Room. Listen as Dr. Nicholas Howland talks with real patients about their real experiences with plastic surgery.
Hello and welcome to the Naked Patient Podcast. Today I have a very special guest with me. This is Nott Ercanback. N-O-T-T is their first name. And Nott is a patient of mine, a friend of mine, and somebody I'm excited to have a conversation with. Welcome.
Hi, thanks for having me.
Absolutely. So you grew up in Utah.
Yes.
Tell me. Give me your. Let's just dive right in. Nott, tell me the background.
Oh, let's see. Utah County, born and raised Mormon, not anymore. That's its own experience, but yeah, it's been great. People can be. They're all right.
You have a big family.
Decent sized, like 4 siblings.
Where are you at in that mix?
I am second oldest.
Okay.
And I'm 20 years old.
Okay.
So
brothers, sisters, where's everybody at?
Older brother, 25, younger brother, I want to say 18, 17, and then younger sibling who is 16.
Okay. And so a lot of people don't watch this podcast. We're gonna actually start uploading them on YouTube so people can watch them if they want to, but a lot of people just kind of listen on Apple. So Nott is a transgender female to male patient. Mm-hmm. And the surgery that we've done top surgery for Nott, which is basically a breast mastectomy, where we removed your breasts and then put nipples back on as a free nipple graft, and here you are.
Yep. It was the best decision I ever made. I'll say that much. Surgery is scary, of course, no matter what, but it was so worth it. Mm-hmm. Just the best thing.
So people are going to want to hear at least about, I want this to be a place where you can comfortably share what the transgender experience is. Okay.
Well, for me, a lot of people say it's like being born in the wrong body. I don't quite agree with that. I think it's more so the disconnection between mind and body. So you eliminate your body, you're just like a soul floating in the middle of nowhere. What are you? That's kind of where that separation from gender and sex comes from, for me at least. So for me, those obviously don't line up, and transitioning is the treatment for that. And I can attest that is.
When did you start to feel that those things weren't lining up in your life?
Probably right when I hit puberty. Mm-hmm. Like, it sounds weird. Before that, I had no idea. I was just living my life. I was a kid. You don't know anything's wrong as a kid. But then, as your body starts changing, things start developing in ways you don't want them to. It's really uncomfortable and confusing knowing that's not supposed to happen, and everyone's telling you, no, this is totally normal. Everyone goes through this. No, everybody doesn't go through this. It's like being covered in ants and you can't get the ants off and no one else can see the ants. Mm-hmm. And it's just pure panic anxiety whenever you think of what's happening, So
you were hating the changes that were happening to your body.
Yeah.
Breast development and having to deal with everything else.
Yeah. It was the worst thing that happened in my life at the time, at least. And it's nothing you can control. It's something I never thought it would happen to me. Like, I would hear about it growing up and I was like, oh, that's weird. That's not going to happen to me. Yeah. And then it did.
Was it a feeling of hating those changes, or was there also a feeling of like wanting to have the more masculine changes?
It was a bit of both. I definitely hated the changes. I did not like what was happening, but it was because I knew it was wrong. Like, I would look at other like peers my age, male peers, they go through changes that I wanted. And I would think, well, why isn't that happening to me? That makes no sense. Mm-hmm. And keep in mind, I had no idea what transgender was until I was in high school. So
sure,
it was very confusing.
And so at what age did you start to kind of express some of those feelings?
Well, I had actually been planning on a mastectomy since I was about 14 years old. Mm-hmm. I didn't know what it was, though. I just knew I'm going to remove this part of my body and no one's going to stop me because I hate it. Mm-hmm. So I've just kind of always been heading in this direction. I just didn't quite know what it meant or the terminology.
Were you binding your breasts at all?
Yeah.
So tell people what that is.
So for me, I used a binder. It is like a tank top, really tight. It's got canvas in the front, and it basically flattens everything out. It's painful, especially when you do it too often. I have affected my ribs, my breathing. It's really not something you want to do unsafely.
Why did you do it?
Just the discomfort. It was too much for me. I couldn't, just the feeling of knowing something's down there was just made my skin crawl.
Yeah.
And it's not a feeling you can really understand unless you've felt it, you know?
Yeah.
So
that's actually a conversation that I will have with colleagues and peers. So transgender surgery was not really supposed, like I hadn't planned on it being a big part of my practice.
Yeah.
When I first, I've been practicing for almost 6 years now. But one of my very first patients that came into my office was a male to female transgender patient, had a breast augmentation done in Thailand.
Yeah.
And it was just terrible. Like her implants were down on her stomach. They had completely bottomed out, and she just hated her body even more now.
Yeah.
And she asked if I would fix it. And I said, well, yeah, absolutely. And she just starts sobbing in my office. Says, and I'm like, what's the problem?
Yeah.
And she says, I've been to 6 plastic surgeons here in Utah. 3 of them said, I don't operate on your kind. And 3 of them said, it's against my religion.
Yep.
And for me, that was such an eye-opening statement to see kind of the lack of care that's provided to the trans community out here in Utah. And it's a big community. I think people don't understand or recognize how big our trans community is here just in Utah.
Yeah, absolutely.
And University of Utah within the last 5 years has developed a bottom surgery department where they can provide those operations for people. And there aren't many of those in the world. And so to have one here in Salt Lake is actually pretty unique.
Yeah.
And overnight, after operating on this patient, the trans community is a very word of mouth community. And so all of a sudden I was seeing more and more patients coming into me for surgeries that I can provide. So I don't provide bottom surgery or what a lot of people recognize as sex change operations, because you need a big center for that. You need a big multidisciplinary team. You need urologists on board, psychiatrists on board, plastic surgery on board, other specialties, and you need that kind of a center.
Yeah.
But the surgeries I do provide are top surgeries, so whether it's male to female or female to male. And I do a lot of body work as well as a lot of facial work, again, both ways, whether we're male to female or female to male. Some of my requirements for my patients are fall in line with what the World Health Organization recommends, which is patients have to be out publicly for at least 2 years. And they have to have a letter from their psychiatrist that they have worked with for at least 1 to 2 years.
Yeah.
And for me, I think it's such a easy requirement to have. And it also ensures that we're doing it for the right reasons and in the right patients.
Yeah.
And right now, the surgery in the trans community has become such a politicized thing in our country.
Yeah.
And there's so much misunderstanding on both sides of what's happening.
Absolutely.
Like, I think you would watch the news today and you would think, hearing that Dr. Howland does trans surgeries, he's doing all these sex change operations for 8-year-olds. Like, that doesn't happen.
It's ridiculous. There's so much misinformation about that. And the medical community for trans people is so limited. It's crazy. I've been discriminated against for general doctor visits, not even about transitioning. Mm-hmm. I've been told, we don't work with your kind, that exact statement. And it's dehumanizing, and it's disgusting. No one would choose to do this. Or I should say, very few people would ever choose to transition just for fun. you know,
Yeah.
it's
Or
it's
just
something
because
you
they
need
feel
to
it's
do.
trendy.
Yeah. It's people who do it for trend doesn't make sense.
That aside? Can we please let people know the trans community is not a trend thing?
No. People who say that, it just shows the ignorance, because no one would put themselves in that position. You lose friends, you lose family, you are treated like a monster in society. People don't want you around their kids. You know, it's more harmful than anything. You know, I think that's the biggest reason why the suicide rates are so high.
Yeah.
It's not because, you know, everyone's mentally ill or they have all these problems. It's because they're not treated with respect.
Yeah.
And decent human, just humanity, you know?
Well, what I tell people that question me about trans surgery is, I don't understand it. I don't. And as you kind of alluded to, you're not going to understand it unless you're actually in that body having that experience. I love the analogy of the ants all over your body.
Yeah.
Because it at least gives me paints the picture a little bit for me. And so what I tell you is I don't understand it.
Yeah.
Because I have not been there, but I can love those people.
Yeah. That's important.
That's all that person needs is somebody to love them.
Yeah.
Trans patients don't need us to understand them.
No.
They just need us to love them.
Yeah.
Same with anybody else on any spectrum.
Yep.
They just need love.
Just basic human respect. And, you know, these are people. They're not these weird, the attack helicopter people that you see on the internet, you know? Like, these are just normal people living their lives.
Yeah.
And people just, it's been politicized to the point where they're just not seen as that.
How has it been with your family? How have your parents kind of seen this, and how has that been?
Yeah, I mean, it's hard. You know, anybody who's come out for anything knows it's hard. My family I'm really lucky to have such an accepting family, but it's a change for everyone. And there's definitely been struggles with it, but I'm lucky. None of my immediate family at least has, you know, cut me off or anything. So that's great.
Yeah.
But that's not the case for everybody.
Oh no. Yeah. A lot of people deal with really hard issues in their family.
Yeah, absolutely. And of course they don't understand it, which is fine. But I really appreciate that their love for me goes above what they may think about my choices.
Yeah. So I had a really beautiful experience that in my life that helped me understand more about the community, really more about just love. And this was a very close person in my life. And I got to be there when she told her mom that she didn't feel like she was herself in her body.
Yeah.
And that she didn't know if she wanted to have breasts anymore. And this was something that she was considering.
Yeah.
And her mom was very kind and understanding and said, okay, like, let me process this, but I don't know what to do with it. Like, what do I call you?
Yeah.
And she kind of looked at her mom and was like, I'm just me. And that hit me as such a significant statement that I'm just me.
Yeah.
My sexuality doesn't change it. My gender doesn't change it. My body doesn't change it. I'm just me.
Yeah.
Kind of like that soul that you talked about at the start, right?
Exactly.
And God, if we could just look past all of that and see people for who they are, I'm just me.
Yeah.
That's all you got to love.
Absolutely. And that's a really common thing for people to experience. It's just a lot of people, me included, family, friends, they're mourning a loss when you come out. They think, oh, the perfect little girl I knew just died, and now I have no kid. But now I have this new kid. Well, I didn't change. I've been this way the whole time. I know it's a transition for those around me, almost more than it is for me, because I'm still the same person on the inside.
Yeah.
Just might look a little different, might sound a little different.
Yeah.
You know?
Here's what I think is such not difficult, but this is what's unique with you in particular.
Yeah.
Is you are one of the most strikingly beautiful women before you transitioned that I have ever seen. So this is very true. And that's not to say you're strikingly beautiful now, but by worldly standards, your face has literally been blown up and put in plastic surgeons' offices as an advertisement for what a beautiful woman should be.
Yeah. Well, I appreciate that.
And so I think that people who know you and saw you go from that to where you are now, again, still very beautiful, but it's not the accepted societal image of a young woman, right?
Yeah.
I mean, that's a hard swallow for a lot of people because
it makes people angry.
They don't understand. Yeah.
Yeah. They think, oh, you looked so great before. Now you're just ugly. Now you're weird. No one's going to like you anymore. Okay. Like,
who the fuck cares if you like you?
Yeah, exactly. I may be perfect to everybody else, but if I'm not happy with myself, that doesn't matter. Mm-hmm. You know? And being an attractive person, not that I'm like the best person in the world or anything, but I have been treated differently from where I was before to where I am now. Mm-hmm. And that's its own thing.
Yeah.
But I don't know, it's a really weird experience to go through, just being treated different.
What's been the hardest part of that? Can you tell me any like instances or share any stories that have been particularly difficult?
Like in what category?
I would like to hear how you've been bullied because of this.
Yeah. Well, obviously medical. Every doctors, they haven't believed me for a lot of things, mostly just because I'm young. In general, that's always been a problem. But after I transitioned and started coming out in that way, I get a lot of weird looks. People make weird comments under their breath. I've had doctors say, we don't work with your kind. I know I already said that, but it's just horrible. And then there's the problem of your peers. You know, why did you shave your head? Why are you, doing all this weird stuff to your body? You know, it doesn't make sense. And then, I don't know, maybe that's not a very specific thing, but the overall experience is just people treat you so much different, so much more different than you would think.
How have you coped with that?
I definitely did it in some unhealthy ways at the start, which, I've learned, I've grown, and that's not me anymore. But that has helped me, like going through those experiences helped me reach out, get help, and find more internal coping mechanisms where it's just, I have to be confident in who I am because I can't expect that from anybody else. Mm-hmm. I don't know if that's a great answer, but
I think that is. It's all internal.
Yeah. There's nothing else you can really do. No. Just power through it, I guess.
It doesn't go away, Mm-mm. And until we have kind of really looked inside of ourselves and accepted ourselves, and that's a daily struggle.
Yeah.
I just had a patient podcast interviewee on, who said, the one thing she's learned in all of her difficulties in life has been to live in the present. And I've heard that before, but she said something that I thought was pretty unique. She said, living in the present means loving myself today for who I am today. I know that it's not perfect. I know that I'm still working on stuff. I know that I still have some depression. I'm still not where I want to be, but I can still love me for who I am today.
Yeah, I love that. I think that's a great way to look at things. You know, transitioning specifically, you get caught up in where you want to be in the future. You know, you want to look like this, you want to be treated like this. And that just leads to disappointment because it's never going to be quick enough. So focusing on the moment and just, you know, taking a break and just realizing these are the parts I like, these are the parts I don't, and that's okay.
Yeah.
Because I'm still me. I think that's a great thing.
I love that. So you said earlier that this was one of the best decisions you ever made, having this top surgery that we did.
Easily.
And like, tell me, like from a physical standpoint, from an emotional standpoint, kind of tell me what has changed and like why it's so much better for you.
So I guess I'll start with the emotional standpoint. Obviously, I've been planning this for a long time, just not knowing what it was. So it's something I really looked forward to. I just never really thought I could make it a reality, but I was determined, so it happened. And before it happened, I was obviously depressed. I could, just the feeling of being in my skin was wretched. I hated it. And after the moment those bandages came off, it was like this feeling of relief and thank goodness, like this is who I was supposed to be. You know, this is correct. Yeah. You know, I would say a lot of my negative feelings towards my body went down by 70% after that surgery. And now I'm a million times more comfortable. And that was great. But then there's a social aspect of it. You know, you tell people you're going to get this operation and they're not happy for you. They think, why would you mutilate yourself? They love to use that word, mutilate. That's not what it is. But people really don't understand, you know, you can get implants, you can get a bigger chest, but the moment you want to take anything away, you're crazy. Yeah. You know?
And I like to perform these operations because nothing more than trans surgery underscores what my core belief is about plastic surgery, which is that it's empowering.
Yeah.
When it's empowering for the individual, right?
Absolutely.
I can't sit here and say breast augmentation is empowering for everybody.
Yeah.
But for the right person, it is.
Absolutely.
And for you, having a mastectomy was empowering for you.
Absolutely.
And nobody can take that away from you. Nobody can stand back and say, no, it's not.
Yeah.
Sorry. It is for me. Yeah. This is individual. And that's like nothing more than trans surgery really underscores that, at least in my mind, truth that plastic surgery is about empowerment.
Yeah.
And that's the whole reason I started this podcast.
Yeah. I love that. I think empowering is the perfect word. You know, it really does give you confidence. And I respect plastic surgeons like to the highest degree. I actually wanted to be a plastic surgeon when I was younger.
I remember you telling me that.
Yeah. Just couldn't do the college. So, but yeah. I
remember your mom. So I know your mom.
Yeah.
You know, I know your mom. And I will deal with some trans patients who have a little bit of regret after the surgery.
Yeah.
For a minute. Like there's a little bit of buyer's remorse there sometimes. And that's not a trans specific thing. There's a lot of like almost all of my patients go through a little bit of buyer's remorse for right around 2 weeks. They get what we call the Great Depression, where they're like, ugh, what did I do? I hate this. I'm hurting. I'm miserable. I wish I could take this back.
Yeah.
And I remember asking your mom, I was like, hey, how is Nott doing? Because sometimes this happens. And she was ecstatic. Tears streamed down her face. And she said, I have never seen Nott so happy, so confident. They have their shoulders back, head up high. And it just made her so happy to see you in a place where you're more confident and more comfortable. And God, the validation that gave me was pretty incredible. And I was just grateful to be able to be a part of that for you.
Yeah. And I'm so appreciative that you were part of that and that you were so accepting in that process. Because, people really aren't. And when I tell you, like, even just waking up after anesthesia, just sitting in there, going like this and then not feeling anything, besides obviously the bandages, all the pain, surgery hurts. It's not a fun experience to go through. But all of that just out the window immediately, just for the pure euphoria of this is finally how it's supposed to be. After all this time waiting, here it is. And it's true. My shoulders were back. That's when you bind and you're trying to hide this, trans people a lot have really bad posture. Yeah. I still have bad posture because of it. Because you're just you hate it. You just want to hide it.
Yeah.
And when it's gone, you're like, oh, great. Yeah. Life's so much easier.
Bad posture is such a physical expression of how we're doing in our lives.
Yeah.
Right. Not always, but so often we're just hunched over, hiding. Yeah. And it's just that physical expression of how things are going internally so often for people.
Exactly.
Can I ask you, this is kind of a weird question.
Yeah.
Okay. But for a cis hetero white male, I would say the organization that Dan Reynolds has put together, Love Loud, is a huge empowering community for the LGBTQ community. That was one of the first experiences that I had kind of within that community here in Utah. And I'll tell that story, but I'd love to get, as a trans patient, I would love your perspective on that.
I guess I'm completely in the dark. I don't know who Dan Reynolds is. Oh, shit. So I guess I'm terrible at that, but...
Okay, that's okay. He probably doesn't listen to the podcast, so you're okay.
Okay.
So Dan Reynolds, the lead singer for Imagine Dragons.
Oh, obviously. All right. Okay, now I get you.
Cut that part out if we need to. Not.
Okay. My goodness. I'm bad at names. That's all right. Okay.
And so this is they do a concert every year. They've done it for 4 years now, I think.
Yeah.
And the whole concert is about just loving everybody, being inclusive, loving everybody. It's a very kind of pride-centric concert.
Yeah. I think I'm remembering now. I just slipped my mind. But as a trans person, seeing any type of support from absolutely anyone it's nice, Honestly, I don't care why people do it, like I do, but, corporations and stuff around Pride Month, everyone changes their logo. They all start to become really accepting during Pride Month. And it seems kind of fake, but I'd rather have that than no support.
Yeah.
And a lot of people get bogged down on that, and it is what it is. But any type of support means everything,
I have seen more and more kind of negativity about all this, it's Pride Month, so all of a sudden every corporation has a rainbow logo.
Yeah.
And you're like, hey, maybe just be nice year round.
Seriously.
Not just 1 month out of the year. My experience with Love Loud and with Dan Reynolds, Imagine Dragons.
Yeah.
I came here in 2017, and I think that was the second year that they did the concert. The first year they did it, it was down in Provo or Orem or somewhere. And it was a much bigger deal than they expected. And so the second year it was up at Rice Eccles Stadium, and I took my 2 kids, and I was like, Imagine Dragons is playing. And I think, Steve Aoki played, and there were some other big names that came and played at this concert. Trees was there, and I was like, this is going to be great. My kids will love this.
Yeah.
And my daughter at the time was, she was 11, and my son would have been 6. And I'm posting like Instagram stories from this concert. I'm literally getting responses from people like, oh, I can't believe you would take your children to such an event. Like, what is happening? And I even questioned for myself a little bit, like, oh, am I exposing my kids to something that I'm not supposed to expose my kids to?
Yeah.
And the whole message from that night, from every single person that took that stage, Tyler Glenn from Neon Trees, Dan Reynolds from Imagine Dragons, the whole message from everybody was, everybody needs to be loved.
Yeah.
Just love. That's it.
Yeah.
That's be kind, love everybody, and that's it. And I went home with 2 young kids who were like, all we got to do is love everybody, Dad. I'm like, yeah, that's it. That's the great secret, guys. And people were literally questioning whether that was something I would expose my kids to or not. Mm-hmm. Come on.
Yep. Kids are a big topic as far as the LGBTQ community goes. Mm-hmm. You know, people think you're trying to turn our kids gay. You're trying to trans our kids. You know, it's the gay agenda. Mm-hmm. We're trying to infect the children. Like, I have better things to do in my life than infect children. You know, everyone does. People aren't trying to indoctrinate your children. Yeah. You know.
Well, I love what you said earlier, which is I would not choose this. No, nobody would choose
you
this.
Wouldn't. And it's not something you're able to choose.
Yeah.
You know, you can pretend. Maybe if you're a really sick person and you really want to, you could pretend, but you would never go as far as transitioning. Or I shouldn't say never. There are people that detransition. Sure. And those people, I respect their stories, but that's not the majority of people, not even close.
Well, again, it's such an individual thing. And so their choice is very individual to them.
Yeah. And they had their own experiences, and that's totally respectful for them. But that also shouldn't impact my experience and stop me from doing what I need to do.
Yeah.
But just, yeah, back to the kids. If I would have known what being trans was as a kid, that would have been so helpful. Would have saved me so much pain. You know, I wouldn't have done anything medically about it. You're not allowed to. Mm-hmm. But just knowing in the back of my mind, like, there's other people that have this experience would have been so helpful, because I genuinely thought I was going crazy.
Yeah, just like, knowing that you had options.
Yeah.
Or being able to hear other stories.
Yeah. Just, it's normal, and it's not something to be afraid of. Mm-hmm. And I don't know. Not having that information, I can say, did hurt me, because, you know, when you don't know, you don't know.
Yeah.
You can't get help for something you don't know about. So, yeah.
What would your advice be to either a parent or, let's do 2 different things, 2 different questions. A, what would your advice be to a parent who has a trans kid? And what would your advice be to the trans kid growing up today?
Yeah. I guess for a parent, I'll start with that one. The biggest thing, you know, I mean, I guess it depends if your kid comes out before or after 18, but I guess not really. The biggest thing you need to do is just love your kid. Treat them like they're still your kid. Don't treat them like they died. You know, if you're going to go through your mourning process, don't involve them in it, you know, because it makes them feel like a burden. As far as transitioning goes as a kid, just name and pronouns. That's all you got to do. You maybe give them a haircut, you know, that's pretty much the extent of it. And if in the future, if they choose to transition and do the things I'm doing, just support them in any way you can. You know, try and remember they're still your kid. They're not an alien. Yeah. And a lot of parents forget that, especially here in Utah, where religion plays a big part of it.
Yeah.
You know, and I guess for the kid, remember that, you know, you love your parents. This is hard for them. They grew up in a different time, you know, all that regular stuff, but just be patient, and hopefully they will come around. And if they don't, then, you know, that's a horrible thing. I guess I don't quite know how to navigate that from a personal standpoint, but just try to be patient with people in general.
Yeah, you're definitely lucky. I think you got to love you.
Yeah. Yeah. And you can only control your own actions.
Yeah.
You know, getting mad or hurt or angry at these people who don't accept you doesn't hurt anybody but yourself.
Yeah.
Just, it makes the negativity so much more negative and hard to deal with.
Yeah. So we're going to wrap up here soon. Let's move away from the trans stuff a little bit, because aside from being trans, you're a pretty fucking cool person regardless.
Thank you.
At least in my experience.
I appreciate that.
You have a big thing coming up. Tell me what you're doing with life.
I am opening a tattoo studio. Well, I've opened it, and I am just working on that.
Yeah.
Got
Nott is
coming.
very talented.
Thank you.
What kind of tattoo work do you do?
So I do both, the artsy traditional tattoos, whatever style, and I do paramedical tattoos is another side of it. So like scar cover up, and just.
And that's a big deal though. Like paramedical tattoos, you actually have to be certified for that, right?
Yeah. Yeah. And I love doing it. That's actually my favorite type of work to do is scar work. Mm-hmm. Just because, I've had my scars covered up, not these ones, other ones. And it's empowering. It's amazing. It makes you feel so much more comfortable.
Yeah.
And it takes away that shame that comes with certain scars.
Is that, I'm scar cover up with tattoos to be empowering. What types of scars are people covering up?
I do a lot of self-harm scars. Mm-hmm. Another one I do that isn't as common, breast cancer. You get a mastectomy, not by choice. You don't have any nipples. I can put those back on there, make you feel a little more at home in your body.
Yeah, the self-harm one is interesting. I see quite a bit of those patients myself, where they've had thigh scars or wrist scars.
Yeah.
And it's a very obvious scar pattern. Mm-hmm. And so and it's hard, you can't fix it without a new scar. Mm-mm. So I love that you're able to do tattoos to cover it up, because for me, the options that I give people are, well, we can cut the whole square of skin out and then put a skin graft over it.
Yeah.
And then you can make up a new story. Or we'll do what's called a Z-plasty, where we rearrange the scar so it's a zigzag instead of an obvious linear self-harm scar.
Yeah.
So I love that there's an option to just tattoo and cover it up.
Yeah. And I think that's amazing, because when you self-harm, carrying those scars with you, some people think it's empowering. Other people, it's just a reminder of the pain. Mm-hmm. So being able to get rid of that is really helpful.
Where is your studio going to be?
So I'm down in American Fork, Main Street. Mm-hmm. It's a really small place, just me. Mm-hmm. It's nothing crazy, but I try to make it really comfortable. Everyone is welcome. And
What's the name of the studio?
So it's Bitter Blue Tattoo. I'll have a sign up there hopefully soon. And yeah, everyone's welcome. If anybody wants a tattoo from me, wants to come down, I have an Instagram. People can contact me on that.
What's your Instagram handle?
It is Not Very Blue, Nott Very Blue. And it's old. I haven't been keeping up with it. So if you need an updated portfolio, contact me, because I definitely have one. But
and you and I have plans in place. So this is an official announcement. Nott has actually designed a beautiful tattoo for me. Mm-hmm. And I've got kind of a whole like half sleeve thing in mind that I want to do, but you're going to be probably the very first piece on there.
I'm honored.
Oh, I'm excited.
Yeah. I love doing people's first tattoos. It's always so fun. Everybody says that, but once you're in the chair, it's not nearly as bad.
Can I drink beforehand?
No. Okay. It's with blood. Obviously, you don't want to drink, smoke.
No.
Don't want to take any blood thinners or anything like that.
Okay.
But just the first tattoo is the hardest.
Yeah.
It really is. Just because the anxiety, it's scary. It doesn't feel great, but it's not as bad as people think.
Yeah.
Once you get one, you can get 1 million.
Okay.
It's not so bad.
I'm ready. I'm excited. And we'll show it. We'll have to, in fact, that's what we'll do. You and I will like line up the dates so that we can do the tattoo, maybe like the day before this thing launches.
Yeah.
And I think that would be a cool thing to show.
Deal. Gladly.
Okay. Anything else you want to add to today?
Just thank you for all you've done for me and other trans people, and just being a great person in general.
Thank you, Nott. Thank you
I
for
really appreciate that.
You've added a lot to my life and to my understanding, and just love. That's the answer. It always is. It's pretty.
Absolutely.
It's pretty damn simple, people.
Absolutely. I totally agree. So thank you.
Thanks, Nott.
Thank you so much for listening to The Naked Patient Beyond the Operating Room. I'm Dr. Nicholas Howland. Please remember that every patient who appears on this podcast has consented to discuss their story and their surgery on the podcast. That way we remain HIPAA compliant. This is a free podcast. The best thing that you can do for us is to leave us a review online. Let us know what you liked. Let us know what you'd like to hear. Let us know how we can improve. If you are curious about anything related to plastic surgery, you can reach out to me on Instagram at Dr. Nicholas Howland, and I typically respond there, or you can reach us at the office at 801-571-2020, or we have an online form you can fill out at the website, www.howlandplasticsurgery.com. Any of our coordinators would be happy to help you. Thanks again for listening.
Thanks for listening to the Naked Patient Podcast. Stay tuned for the next episode. Till next time.